All right, let's dive into something we literally wear every single day, but might not give a lot of thought to, our skin.
Oh, it's definitely more than just a covering, that's for sure.
It really is.
Mm.
Today, we're taking a deep dive into the integumentary system.
AKA skin.
Exactly.
Yeah.
It's this incredible protective layer
Yeah.
that also happens to be our largest organ, which is wild when you think about it.
It really is. It's easy to forget that sometimes.
Totally. So we've gathered some fascinating sources for this deep dive, covering everything from how pressure sores actually develop to those
Yeah.
weird nail conditions that make you go, huh, how did that even happen?
Right, like those clubbed nails. Super interesting stuff.
Definitely. So our mission, should we choose to accept it, is to really break down how this amazing organ works,
What can go wrong?
what can go wrong exactly, and even how healthcare pros use skin as a diagnostic tool. Ready to get skin deep.
Absolutely, let's dive in.
Okay, so first things first, the structure.
Yeah, gotta start with the basics.
Right, so our skin has three main layers.
Epidermis, dermis, and the subcutaneous tissue. Kind of like a complex shield with like multiple layers of protection.
Okay, I'm picturing tiny little warriors in each layer
Yep.
fending off threats. But how does that top layer, the epidermis, constantly renew itself? That always blows my mind.
It's pretty wild. So it's this continuous process where the outermost layer is constantly shedding dead cells, and new cells from the lower layers are like pushing up to replace
It's
them.
like a conveyor belt of skin cell.
Basically. And what's crazy is you essentially get a whole new epidermis every 35 to 45 days.
Whoa, that's like a full body makeover every month and a half without us even realizing it.
Pretty much.
And speaking of makeovers, I know you mentioned melanin earlier, that pigment that gives our skin its color. What can variations in melanin tell us about someone's health?
Oh, those variations can be super informative. So, for instance, if someone has really pale skin, like unusually pale, what we call pallor, that could point to anemia or maybe poor circulation. And on the flip side, you know that redness we see with inflammation, erythema, that can signal an infection or an allergic reaction.
Ah, so it's like our skin's color is a secret language telling us what's going on inside.
Exactly. It's like a visual cue that something might be off.
Okay, so we've talked about the looks, but what about the function? I mean, we always hear about skin's protective role, but how does it actually act as a barrier?
So picture this. The epidermis is like a tightly woven fabric, okay? The cells are all linked together by special junctions, and there's this layer of keratinized cells, like extra tough cells, that prevent most pathogens and harmful substances from getting through.
So it's like a suit of armor.
Pretty much. It's our first line of defense against, well, everything out there.
Makes sense. And it's not just about keeping stuff out, right? Skin also helps regulate our internal environment, like temperature control.
Oh, absolutely. It's like a built-in thermostat. So when we get hot, our blood vessels dilate, which allows heat to escape, and our sweat glands kick into gear, releasing sweat, which then evaporates and cools us down.
So it's like this finely tuned system, constantly making adjustments to keep us comfortable.
Exactly.
What about those sensory experiences, though? How does our skin allow us to feel things like touch, temperature, and pain?
Well, that's where those specialized nerve endings come in.
Oh, right. I remember reading about those.
Yeah, so we've got mechanoreceptors that respond to pressure and vibration, which lets us feel different textures.
And distinguish objects.
Right. And then there are thermoreceptors, which, as you might guess, detect changes in temperature, letting us know if something's hot or cold.
And then those nociceptors, those are the ones that signal pain. Right. Letting our brain know that something's wrong and we need to pay attention.
Exactly. All these nerve endings are constantly sending info to the brain, allowing us to interact with the world around us and, protect ourselves.
It's amazing how much is happening under the surface.
Mhm.
And here's something that always blows my mind. Skin's role in vitamin D synthesis. I knew it was important, but I never really understood how it works.
So, when our skin is exposed to UVB radiation from the sun, there's this compound that gets converted into vitamin D.
So we're literally soaking up sunshine to create something essential for our health.
Pretty much. And vitamin D is crucial for calcium absorption, bone health, even immune function.
Wow, that's remarkable. Okay, but let's talk about those often overlooked but crucial parts of the skin. The glands. What about those sebaceous glands, the ones that produce sebum?
Yes, sebum, that oily substance that keeps our skin and hair lubricated, prevents dryness, provides a waterproof barrier, our body's natural moisturizer.
Right, right. But I've heard sebum can be a double-edged sword, especially for teenagers. What happens there?
Well, during puberty, hormones go wild, right? And that can cause those sebaceous glands to go into overdrive, producing way too much sebum.
Leading to clogged pores and acne.
Exactly. It's a natural process, but definitely a frustrating one for teenagers dealing with breakouts.
For sure. So basically, those teenage skin woes are a hormonal battle playing out on the surface.
You got it. But let's not forget about those other glands, like the endocrine glands. They have a totally different job, but just as important.
Right. Those are all about sweating, right?
Right.
But it's more than just cooling us down, isn't it?
Oh, yeah, much more. Endocrine glands are all over our body, and they release sweat, which is mostly water and electrolytes.
Okay.
This helps regulate body temperature, of course, but it also plays a role in eliminating waste products.
So our skin is like a tiny filtration system, too.
In a way, yes. And then you've got the apocrine glands, which are mostly in like the armpits and groin area.
Right. Those always seemed a bit mysterious to me.
Well, they become active during puberty, and they release a thicker sweat that, when broken down by bacteria, can cause body odor.
Ah, so that's where that comes from.
But they also play a role in releasing pheromones.
Pheromones, those fascinating chemical messengers. So our skin is communicating on a whole other level without us even knowing it.
It's a whole world of scent signals that we're not even conscious of, influencing social interactions and even attraction.
Wow, that's something to think about. But let's shift gears a bit and talk about how healthcare professionals use skin as a diagnostic tool. I mean, it's amazing how much they can learn just by looking at and touching our skin.
It's true. Checking skin turgor, for example, which is how quickly the skin bounces back after being pinched, can indicate dehydration.
Oh, that makes sense. And we talked about skin color changes earlier, but are there other visual cues that can alert healthcare professionals to potential problems?
Oh, definitely. The appearance of lesions, rashes, unusual growths, those can all be red flags. Even the way a wound heals can offer insights into overall health and immune function.
So healthcare professionals are trained to see beyond the surface and recognize those subtle signs that something might be off.
Exactly. They're like skin detectives.
I like that, skin detectives.
Mm.
And speaking of clues, I know we have this whole visual glossary of skin conditions describing those different types of lesions. It's like a dermatology field guide. Where should we even begin with all that?
Well, let's start with some of the most common types of lesions that healthcare professionals look for, like macules. Those are flat, discolored spots on the skin.
Like freckles or flat moles?
Exactly. And then there are papules, those solid raised bumps that you can feel, like those annoying acne pimples.
Okay, and what about those larger, deeper bumps? Are those more concerning?
Those would be nodules. And yeah, they can signal a wider range of things, from benign growths to more serious conditions. That's why it's so important to have any unusual skin changes checked out by a professional.
So it's not just about identifying the lesion, it's about understanding what it might mean.
Precisely. Each type of lesion has its own unique characteristics and potential implications.
Okay, so there's a lot to learn, but I'm sure with your guidance, we can navigate this whole dermatology landscape and gain a better understanding of what our skin is trying to tell us.
We'll definitely break it all down step by step. It's all about empowering yourself with knowledge, right?
Absolutely.
It really is. Knowing the basics can make those doctor visits less intimidating, you know? You can ask better questions, understand the lingo better.
Totally. Like you're not just passively listening, you're actively engaged.
Exactly. Okay, but enough about lesions for now. Let's move on to the actual diagnostic process.
Yeah, how do healthcare pros actually figure out what's causing a specific skin issue? It seems like there are so many possibilities.
It's true, there can be a lot going on, but usually it starts with a good old-fashioned visual inspection combined with a thorough medical history.
So like, what are your symptoms? Have you been exposed to anything weird, that sort of thing?
Yeah, exactly. We ask about any potential allergens or irritants you might have encountered, any family history of skin
It's
conditions.
like playing detective, gathering clues.
Oh, totally. And depending on what we suspect, we might run some additional tests. For infections, for example, we can take a culture to see what kind of bacteria or fungi is involved.
Makes sense. So you know exactly what you're dealing with.
Right, that way we can prescribe the most effective treatment.
Okay, what about allergies? How do you pinpoint those sneaky triggers that cause skin reactions?
Allergy testing can be really helpful for that. We basically expose a small area of your skin to potential allergens and see what happens.
So if it gets red or itchy, you've found the culprit.
Exactly. It's a controlled way to identify what your skin doesn't like.
Cool. What other tools do dermatologists have in their arsenal?
Oh, we've got a few tricks up our sleeve. There's the woods lamp, for example, which uses ultraviolet light to make certain skin conditions like fungal infections light up.
Whoa, really? Like a black light?
Kind of. It helps us visualize things that might not be obvious under normal light. And for suspected fungal or parasitic infections, we can take a skin scraping and look at it under a microscope.
So you can actually see the little buggers.
Sometimes, but what if all that isn't enough? What if the visual inspection and those tests don't give us a clear answer?
Yeah, what happens then?
Then we might have to do a skin biopsy. It sounds scarier than it is, I promise.
Okay, but what is it exactly?
We take a small sample of skin and send it to a lab where they can examine it under a microscope, really get a close look at the cells. It can help diagnose a whole range of conditions, from inflammatory disorders to skin cancer.
So it's like the ultimate diagnostic tool, providing a deeper level of insight.
Exactly. It's like zooming in on the cellular level to see what's really going on.
Okay, well, that makes sense. Now, let's talk about treatment. I know there's a ton of options out there, from simple creams to more involved procedures. Let's start with the everyday stuff, like dryness and itchiness. What are some common ways to tackle those?
For dryness, emollients are usually the first line of defense. Those are just fancy words for moisturizers.
So, like giving your skin a nice drink of water.
Exactly. And for itchiness, we often recommend antihistamines, either topical or oral. They block the release of histamine, which is the chemical that triggers that itching sensation.
Okay, that makes sense. What about more targeted treatments, like for bacterial skin infections? How do you usually approach those?
Antibiotics are the go-to for bacterial infections. They can be topical, like a cream, or oral, like pills. Either way, they work by either killing the bacteria or stopping them from growing, which gives the skin a chance to heal.
Makes sense. And what about those pesky fungal infections? I hear those can be really stubborn.
Oh yeah, they can definitely be tricky. But we've got antifungal medications for those, also in various forms like creams, powders, or even oral meds. It depends on how severe the infection is and where it's located.
So you tailor the treatment to the specific type of infection.
Exactly. But what about those conditions that aren't caused by infections, like eczema or psoriasis? How do you manage those?
Yeah, I was wondering about those.
For those types of inflammatory conditions, we often turn to corticosteroids. They can be topical or oral, and they help reduce inflammation and itching.
Corticosteroids, okay. I've also heard about light therapy being used for certain skin conditions. How does that even work?
Light therapy involves exposing the skin to specific wavelengths of light, which can actually suppress the immune response and reduce inflammation. It's often used for conditions like psoriasis and eczema.
So you're basically using light to heal the skin.
Pretty much. But what if those standard treatments aren't enough? What if the condition is really severe or resistant?
Yeah, what are the options then?
Well, then we have to get a bit more high-tech. There are things like biologic therapies, which target very specific parts of the immune system that are involved in inflammation.
So it's like a more targeted approach.
Exactly. Those are typically reserved for the more challenging cases.
Wow, it's incredible how far dermatology has come. But with so many different skin conditions out there, it's hard to know where to start. Maybe we can dive into some specific examples, starting with allergic dermatitis. What exactly causes that super itchy red reaction?
Allergic dermatitis happens when your immune system overreacts to something it considers a threat, even if it's harmless. We call those things allergens.
So it's like a case of mistaken identity.
You got it. Common allergens include things like pollen, pet dander, certain fabrics, even some metals.
Wow, that's quite a list. And how do you typically treat allergic dermatitis?
Well, the first step is figuring out what the allergen is and avoiding it, if possible. Then we can use topical corticosteroids to reduce the inflammation and itching, and antihistamines to block those histamine effects.
Okay, so it's a combination approach. What about exfoliative dermatitis? You mentioned earlier that it's more serious, involving widespread skin shedding. What makes it so different?
Exfoliative dermatitis is a whole-body inflammatory reaction that affects the entire skin surface. It can be triggered by a bunch of different things, like medications, underlying medical conditions, even certain cancers.
That sounds pretty intense.
It definitely can be. Treatment usually focuses on figuring out what's causing it and addressing that underlying issue, if possible. We also provide supportive care, like cool compresses and soothing baths to help with the symptoms. And in severe cases, systemic corticosteroids might be necessary to get the inflammation under control.
So it's a bit more complex than allergic dermatitis.
Yeah, for sure. Now let's talk about eczema, or atopic dermatitis. It's a chronic condition, right? So that means it can be ongoing.
That's what I was wondering.
Exactly. Eczema is a chronic inflammatory condition that tends to flare up periodically. You usually see dry, itchy skin, but it can also manifest as red, scaly patches or even oozing blisters. Sometimes the skin gets thickened and leathery, too.
So the symptoms can vary quite a bit.
They can, and they also tend to change depending on your age and what triggers your eczema. Common triggers include allergens, irritants, stress, even changes in temperature or humidity.
So it can be a bit unpredictable.
They can, which makes it tricky to manage. There's no cure for eczema, unfortunately, but there are ways to manage the symptoms and prevent those flare-ups.
Okay, so what are some strategies?
Moisturizing regularly is key. That helps keep the skin barrier strong and healthy. And during flare-ups, topical corticosteroids can really help control the inflammation and itching. Avoiding those triggers is also important, but that can be tough if you don't know what they are.
Right, it's like detective work again.
It really is. Okay, let's move on to acne. I feel like everyone has a story about acne.
Oh, absolutely.
Yeah.
What causes those breakouts, scientifically speaking?
Acne vulgaris, the most common type, is basically a combo of hormonal fluctuations, excess sebum production, and bacterial overgrowth.
Okay, so break that down for me.
During puberty, hormones are surging, and that makes the sebaceous glands go into overdrive, producing way too much sebum, that oily stuff.
Right.
And that excess sebum, along with dead skin cells, can clog the pores, creating the perfect environment for bacteria to party.
Ugh, so it's like a recipe for pimples.
Pretty much. But why do some people seem to get hit harder than others?
Yeah, that's a good question. This doesn't seem fair.
Genetics plays a big role for sure. Some people are just predisposed to acne, and your skin type matters too. Some skin types are oilier than others, which can contribute to breakouts.
Okay, that makes sense. But thankfully, there are treatments, right?
Absolutely. Mild cases often respond well to over-the-counter cleansers and topical treatments with ingredients like benzoyl peroxide or salicylic acid, but for more stubborn cases, we might need to bring in the big guns. Prescription medications like topical retinoids, oral antibiotics, or even hormonal therapies.
So there's hope for even the most pizza-face cases.
Absolutely. We've got a lot of tools in our toolbox. Now, what about rosacea?
Hmm?
We sometimes call it adult acne, but is that accurate?
Yeah, I was wondering about that.
Well, they both involve redness and bumps, but they're actually quite different. Rosacea has its own unique causes and triggers. We don't know exactly what causes it, but we think it's a combo of genetics, abnormal blood vessels, and even these tiny mites that live on everyone's skin.
Oh, that's interesting. So it's more than just having sensitive skin.
Right. And unlike acne, rosacea usually affects the central areas of the face, the cheeks, nose, forehead.
Okay, so different locations too. What about triggers?
Common triggers include sun exposure, alcohol, spicy foods, stress, even extreme temperatures.
So it's a bit of a mystery, and everyone's triggers can be different.
Exactly. Treatment often involves lifestyle changes, like avoiding those triggers, as well as medical therapies. Topical medications like metronidazole or azelaic acid can help reduce the redness and inflammation, and in more severe cases, we might prescribe oral antibiotics. Sometimes we use laser therapy to target those visible blood vessels and reduce the redness.
Okay, that's good to know. Now let's talk about boils. Those sound painful.
They can be. Technically, they're called furuncles. It's basically a bacterial infection of a hair follicle. It starts as a red, swollen, painful bump, and then it might develop a white or yellow center filled with pus.
Ugh, that sounds awful. What causes them?
Usually it's caused by Staphylococcus aureus bacteria, which are actually pretty common on the skin. They get into the hair follicle through a cut, a scratch, or even an ingrown hair.
So how do you treat them?
Warm compresses can help draw the pus out, and sometimes we use antibiotics to kill the bacteria. In some cases, the boil needs to be drained surgically.
So you might actually need a minor procedure.
Sometimes, yeah. But let's move on to carbuncles. Those are related to boils, right?
Yeah, you mentioned those earlier. What's the difference?
A carbuncle is basically a bunch of furuncles that have joined together under the skin. It's like a super boil. They tend to be bigger and deeper than regular furuncles, and they can cause more severe symptoms like fever and fatigue.
Oh no, that sounds even worse.
They can be pretty nasty, but luckily they're less common. Treatment is similar to that for furuncles, but we often need to use antibiotics for a longer period, and sometimes surgical drainage is necessary too.
Okay, well, I'll try my best to avoid both boils and carbuncles. Now let's move on to psoriasis. You mentioned it's a chronic inflammatory condition. What does that mean exactly?
In psoriasis, the immune system mistakenly attacks healthy skin cells, making them grow way too fast. They then pile up on the skin's surface, forming those characteristic red, scaly patches.
So the body is basically attacking itself.
Kind of, yeah. It's not fully understood why this happens, but we think both genetics and environmental factors play a role. And while it's not contagious, it can be really tough to live with.
It sounds like it. What are the treatment options?
Unfortunately, there's no cure for psoriasis, but there are treatments that can help manage the symptoms and improve quality of life. Topical medications like corticosteroids and vitamin D analogs can help reduce the inflammation and slow down that rapid skin cell growth. And for more severe cases, we might use light therapy, oral medications, or even biologic injections.
So there's a whole spectrum of options depending on the severity.
Exactly. Now let's talk about scabies. This one is definitely not for the faint of heart.
Yeah, you mentioned it's highly contagious and super itchy. What causes it?
Tiny mites. These little guys burrow into the skin and lay their eggs there. It's spread through direct skin-to-skin contact or even through contact with infected clothes or bedding.
Ew. That's making me itch just thinking about it.
It's definitely not pleasant. Intense itching is the most common symptom, especially at night. You might also see these thin, wavy red lines on the skin. Those are the burrows that the mites create.
Okay, so how do you get rid of these creepy crawlies?
We use a scabicide cream or lotion that kills the mites and their eggs, and it's really important to treat everyone who has been in close contact with the infected person to prevent them from getting it too. And of course, thorough cleaning of clothes, bedding, and other personal items is essential to get rid of any lingering mites.
So it's a multi-pronged attack. All right, let's talk about those fungal infections that seem to be everywhere. What are dermatophytes, and why are they so good at infecting our skin, scalp, and nails?
Dermatophytes are a type of fungi that love warm, moist environments. They feed on keratin, a protein found in our skin, hair, and nails. It's like their favorite food.
Ah, so those areas are like a buffet for them.
Exactly. What are some common types of tinea infections?
Yeah, I've heard of ringworm. Is that one?
Ringworm, also known as Tinea corporis, is a classic example. It usually shows up as round, red, scaly patches on the body. Then there's Tinea curis, or jock itch, which affects the groin area. It's super itchy and usually red, often with a ring-shaped rash.
Okay, and what about athlete's foot? Is that a tinea infection too?
Yep, athlete's foot, or Tinea pedis, is another fungal infection that loves those warm, moist environments between our toes. It can be itchy, scaly, red, and even cause blisters.
Ugh, not a pretty picture. So how do you treat these fungal infections?
Most cases can be cleared up with over-the-counter antifungal creams or powders. But for more stubborn infections, we might need to prescribe something stronger, either topical or oral.
Okay, so it's always best to see a doctor if those over-the-counter remedies aren't working. Finally, let's talk about shingles. You said it's caused by the chickenpox virus, but I thought once you had chickenpox, you were immune for life.
Well, you are, in a sense. After you recover from chickenpox, the varicella zoster virus, which is what causes chickenpox, actually stays dormant in your nerve cells. But for some reason, it can reactivate later in life, traveling along those nerve pathways to the skin and causing shingles.
So it's like a chickenpox flashback, but way worse.
Pretty much. The main symptom is a painful rash that usually appears on one side of the body, often in a band-like pattern. It starts as small red bumps that turn into fluid-filled blisters. You might also have a fever, headache, fatigue, and sensitivity to light.
Huh, that sounds miserable.
Yeah.
So how do you treat shingles?
Antiviral medications like acyclovir or valacyclovir can help shorten the duration of the illness and make the symptoms less severe. Pain relievers are also helpful, and sometimes we prescribe corticosteroids to reduce the inflammation.
Okay, so there are ways to manage the symptoms. But is there any way to prevent shingles altogether?
Yes, there are vaccines that can significantly lower your risk. The CDC recommends the shingles vaccine for adults aged 50 and older.
So it's worth talking to your doctor about, especially if you're in that age group.
Wow, it's amazing how much we've covered. I mean, our skin seems so simple at first glance, but there's a whole universe happening beneath the surface.
It really is a fascinating organ. So much more than just a covering, right? It's constantly reacting and adapting to everything we encounter in the world.
And as we've seen, those reactions can range from subtle changes in color to these full-blown conditions like shingles or exfoliative dermatitis. It makes you realize how interconnected everything is.
Exactly. Something happening deep inside can show up on our skin, giving us clues that something might be off balance.
It's like our skin is talking to us, sending us messages.
In a way, yes. It's a reminder that health isn't just about treating symptoms in isolation. It's about looking at the whole picture.
Okay, that makes sense. So what are some everyday things we can do to keep our skin healthy? I mean, besides slathering on sunscreen, which we should all be doing anyway. Well, a lot of it comes down to those basic healthy habits we always hear about. Eating a balanced diet,
Hmm.
lots of fruits, veggies, healthy fats.
Staying hydrated.
Definitely.
Yeah.
And managing stress, getting enough sleep.
It all shows up on our skin, doesn't it?
It really does. The food we eat, how well we sleep, even how we handle stress, it all plays a role.
It's all connected. And of course, protecting our skin from the sun is crucial. Sun damage is no joke.
Absolutely. Sunscreen, shade, protective clothing, all of that is essential. It's not just about vanity, it's about protecting the health of our largest organ.
Well said. This deep dive has really opened my eyes. I feel like I have a whole new appreciation for this incredible organ we wear every day.
I'm glad to hear that. And as we wrap up, I want to leave you with a thought-provoking question. If your skin could talk, what would it say about your current lifestyle? What messages is it trying to send you?
Ooh, that's a good one. It really makes you stop and think, doesn't it? Are we listening to those subtle cues our skin is giving us? Are we making choices that support its health and vitality?
Exactly. Knowledge is power, as they say. The more you understand about your skin, the better equipped you'll be to take care of it.
Absolutely. To all our listeners out there, thanks for joining us on this deep dive into the fascinating world of skin. We hope you learned something new, gained a new appreciation for this incredible organ, and maybe even got inspired to give your skin a little extra TLC. Until next time, keep exploring, keep learning, and keep taking care of yourselves.